Brought to you by GTA. We start with you.
Months in the making, and Guam Memorial Hospital Administrator Lillian Posada says the COVID Isolation Facility, or SIF, at the skilled nursing unit in Barrigada Heights is just about ready. The portable chiller, which was stuck in procurement and had one problem after another, was finally installed over the weekend.
They turned it on last night, and so the temperature as of this morning is at 63 degrees. We want to make sure that we monitor it and it's consistent, and that the facility is cool enough for us to occupy with patients.
Posada says they are hoping to move patients sometime today. With COVID beds running out at GMH, the 54 beds at the SNU is direly needed. The hospital administrator adds that discussions have been held with FEMA about converting the SIF or SNU into an alternate care facility, which would not only be able to handle the overflow of COVID patients, but also provide ICU level of care.
We've put together our plan. It is about 95% complete, and what Brian Trang from FEMA was able to review, he seems to be very satisfied with what we put together in that plan.
While the hospital builds bed capacity, they're still in need of staff. Just today, 15 GDOE nurses underwent orientation at GMH. Meanwhile, instead of using space at the Guam Surgery Center to move non-COVID patients, Posada says they've gone with another option.
What was more practical and what was going to be more beneficial was the staffing. They've offered about 9 of their nurses to go up to GRMC to help GRMC, so that way GRMC can have more rooms for non-COVID patients. And so I think that's what finally we all agreed.
According to a letter written by the governor on August 8th to the CDC, she wrote that Guam is prepared for any surge in hospitalizations with 83 COVID-designated hospital beds, with a capacity to increase beds to 200 or more. On the link, Posadas confirms at GMH there are a total of 59 beds for COVID patients. As of this morning, 38 were occupied, leaving 21 beds for COVID patients left at the hospital.
It just seems like it's beyond serious. If there's only 21 beds available, and say all 21 are serious and need medical attention.
Yeah. I mean, this is where we're really going to need to call all our resources, what we've got, where we can put them.
If the SNU comes on board today, it would add 54 more beds for COVID patients. Reporting for Guam's News Network, I'm Sabrina Salas, Matanani.
Brought to you by GTA. We start with you.